because when we look at that question, I was asked in 2007 when sorafenib was approved, they said, what does the future look like? It's, we're going to have so much activity here. We've proven we can get a drug approved in liver cancer, and we're just going to have more and more drugs. And obviously that prediction was not perfect because it took us a long time to get to our next approval, about 10 years. And now in liver cancer, we've just had a burst of positive data. And now with the positive phase 3 data with atezolizumab and bevacizumab from the IMbrave 150 study, this has really launched the field forward dramatically. And I think there's going to be some challenges for us, right? Because if the control arm or the frontline treatment is now 2 years, maybe survival, and we've seen that clue from a few other studies. But if we're getting out, 20 months or longer, what is going to beat that? And I'm not sure offhand. Are we looking at a triplet or a totally different mechanism of action? And it's going to take some time to think about that and try to do that carefully, rather than just empirically adding things on and then getting negative data. And I think maybe the biggest impact will be moving these highly effective new regimens into earlier stage disease. And I think that is an area that we're all hoping to see, that we can increase cure rates after surgery or after chemoembolization. And in any other tumor type, that's often how we make the biggest difference, is moving from advanced disease to earlier disease.